Welcome to Lesson 14, Biopsy versus Excision versus Destruction, part of our 2026 CPC exam medical coding course. In this lesson, we'll learn the key differences between these three important integumentary procedures and how to recognize them from documentation. Remember the core CPC rule: biopsy means sample, excision means remove, destruction means destroy. Let's begin and build a strong foundation for accurate CPC coding. Before we begin, let's review the objectives for this lesson. We'll learn the purpose of a biopsy, excision, and destruction, and most importantly, how to distinguish these procedures based on the provider's documentation. We'll focus on important details such as the anatomic site, technique, size, and tissue involved. We'll also apply these concepts to CPC-style scenarios and identify common coding traps and bundling considerations. Keep this simple CPC memory rule in mind: biopsy means sample, excision means remove, destruction means destroy. This lesson is provided for educational and CPC exam preparation purposes and contains original educational explanations and practice scenarios. It does not contain actual CPC exam questions and is not affiliated with or endorsed by AAPC or any certification body. For coding accuracy, always verify the current CPT, ICD-10-CM, HCPCS Level 2, CMS, NCCI, payer, and other applicable official coding guidance before making coding decisions. Now, let's begin with the first key concept: biopsy. Now let's understand the purpose and basic concept of a biopsy. A biopsy is performed to obtain a tissue sample for diagnostic examination. In simple terms, a small sample is taken from a lesion or tissue and sent for evaluation. The main purpose is biopsy right pointing arrow sample right pointing arrow diagnose. Depending on the documented technique, a skin biopsy may involve tangential, punch, or incisional sampling. As a CPC coder, pay attention to the lesion or tissue sampled, exact anatomic site, documented technique, number of lesions, and depth or extent when relevant. Also check whether another procedure was performed on the same lesion or a different lesion, because this can affect separate reporting and bundling considerations. Here's an important CPC trap: a biopsy does not automatically mean the entire lesion was removed. The primary purpose of a biopsy is to obtain tissue for diagnostic evaluation. The provider's documentation determines exactly what procedure was performed. Remember, biopsy equals sample for diagnosis. Always identify the technique, site, and tissue sampled, then verify the applicable current CPT guidance. Now let's understand the purpose and basic concept of excision. An excision is a procedure in which a lesion or tissue is surgically removed. The main concept is excision right pointing arrow remove right pointing arrow treat or evaluate. Unlike a biopsy, where the primary purpose is to obtain a diagnostic sample, an excision generally involves removing the lesion. As a CPC coder, identify what was excised, the exact anatomic site, the applicable lesion measurement, margins when required, depth and tissue removed, number of lesions, technique, and any additional procedures. For applicable skin lesion excision code families, remember the measurement concept: greatest clinical lesion diameter plus required margins equals excised diameter. A common CPC trap is assuming that the final surgical wound size automatically determines the excision code. That is not necessarily correct. Follow the applicable lesion measurement and margin rules for the specific code family. Your CPC workflow is: identify the site right pointing arrow, identify the procedure right pointing arrow, apply the measurement and margin rules right pointing arrow, verify current CPT guidance right pointing arrow, select the supported code. Remember, excision equals remove the lesion. Always base your code selection on the provider's documentation and current official coding guidance. Now let's understand the purpose and basic concept of destruction. Destruction means that a lesion is destroyed using a destructive technique, rather than being surgically excised as a specimen. The core concept is destruction right pointing arrow destroy right pointing arrow treat the lesion. Depending on the documented procedure, destructive techniques may include cryotherapy or cryosurgery, electrosurgical techniques, laser treatment, or other applicable destructive methods. As a CPC coder, carefully identify the type of lesion, exact anatomic site, number of lesions, technique used, and the service actually performed. Also determine whether another procedure was performed on the same lesion or a different lesion, and check the applicable CPT instructions and bundling rules. Here's the common CPC trap: If a lesion is removed from the body, it must be coded as an excision. Not necessarily. The documented technique and intent determine whether the service represents destruction, excision, biopsy, or another procedure. Remember, destruction equals destroy the lesion. The key is to identify the lesion, site, technique, and number, then verify the current CPT guidance before selecting the supported code. Now let's compare biopsy and excision, two procedures that are important for CPC exam questions. A biopsy is primarily performed to obtain a tissue sample for diagnostic evaluation. Remember, biopsy right pointing arrow SAMPLE. An excision, on the other hand, involves surgically removing the lesion or tissue. Remember, excision right pointing arrow REMOVE. When reviewing documentation, the CPC coder should identify the purpose of the procedure, what tissue was obtained or removed, the technique, anatomic site, and applicable size or margin information. Here is an important CPC trap. If tissue is sent to pathology, it must be a biopsy. That is not necessarily correct. Tissue removed during an excision can also be sent for pathological examination. So, pathology submission alone does not determine whether the procedure was a biopsy or an excision. Instead, ask, what procedure did the provider actually perform? What was the documented intent and technique? Your memory rule is simple. Biopsy equals sample. Excision equals remove. Always verify the applicable current CPT instructions and coding guidelines before selecting the code. Now let's compare excision and destruction. With an excision, the lesion is surgically removed. Remember, excision right pointing arrow REMOVE. For applicable excision code families, the coder may need to consider the anatomic site, excised diameter, and applicable margin rules. With destruction, the lesion is treated using a destructive technique rather than being surgically removed as an excision specimen. Remember, destruction right pointing arrow DESTROY. The key difference is the procedure and technique documented by the provider. Here's the CPC trap. Any treatment that eliminates a lesion is an excision. Not necessarily. A lesion can be treated using a destructive technique without being coded as an excision. So ask, was the lesion surgically removed, or was it treated using a destructive technique? Your CPC memory rule is, excision equals remove. Destruction equals destroy. Always base code selection on the provider's documentation and verify the applicable current CPT instructions and coding guidelines. When in doubt, don't code by the outcome alone. Code from the documented procedure performed. Now let's look at technique, documentation, and code selection. The first step is always to start with the provider's documentation. The documented technique helps us understand what procedure was actually performed. For a biopsy, identify the documented biopsy technique. For an excision, confirm that the lesion or tissue was surgically removed. For destruction, identify the documented destructive treatment. Next, review the important documentation details, procedure performed, technique, anatomic site, lesion type, number of lesions, applicable size or measurement, margins, depth and tissue treated, and whether the procedure involved the same or a different lesion. Then follow the coding workflow. Documentation right pointing arrow technique right pointing arrow site and lesion details right pointing arrow CPT guidelines right pointing arrow NCCI or bundling check right pointing arrow supported code. Here is the common CPC trap. The diagnosis tells me which procedure code to report. Not by itself. The diagnosis tells us about the condition, while the procedure documentation tells us what the provider actually did. Your CPC memory rule is, read right pointing arrow identify right pointing arrow verify right pointing arrow CODE. Never select a biopsy, excision, or destruction code based only on the diagnosis. Base your selection on the documented procedure and technique, and always verify the current official coding guidance. Now let's look at an important NCCI concept, same lesion versus different lesion. When a biopsy and a lesion removal procedure occur during the same encounter, the first question is, are they performed on the same lesion or on different lesions? If the same lesion is biopsied and then removed, the applicable NCCI guidance generally treats the biopsy as included in the lesion removal service. Remember, same lesion right pointing arrow think bundle. Now consider a different situation. Lesion A is biopsied, while lesion B is separately removed. Because these are different lesions, the biopsy may be separately reportable, when supported by the documentation and applicable CPT and NCCI rules. Remember, Different lesion right pointing arrow check separate reporting. As a CPC coder, verify which lesion was biopsied, which lesion was removed or treated, whether the lesions are truly separate, and whether an NCCI PTP edit applies. Also remember that a modifier should never be added automatically. It must be supported by the circumstances and applicable coding rules. Here's the CPC trap. A biopsy and removal performed on the same day are always bundled. Not always. The critical question is, same lesion or different lesion? For 2026, always verify the current NCCI policy and applicable edits for the date of service. Your memory rule is, same lesion right pointing arrow think bundle. Different lesion right pointing arrow check NCCI. The key takeaway is simple. Identify the exact lesion associated with each procedure before deciding whether separate reporting is appropriate. Now let's focus on an important 2026 special point. Always verify the current captain and NCCI rules. CPT and NCCI information can change, so we should use the rules that apply to the specific date of service. For 2026, CMS has a dedicated NCCI policy manual chapter covering the integumentary system. NCCI edits and files are also updated periodically. As a CPC coder, verify the current captain code and instructions, the procedure documented, anatomic site and lesion details, applicable NCCI PTP edits, MUE information when relevant, modifier requirements, bundling rules, and payer guidance. Here is the CPC trap. I learned this rule previously, so it must still be correct for 2026. Not necessarily. Coding rules, code sets, and NCCI edits can be revised. Never rely only on an old codebook, old NCCI file, or outdated study material. Your CPC memory sequence is date right pointing arrow captain right pointing arrow guidelines right pointing arrow NCCI right pointing arrow verify right pointing arrow CODE. The key takeaway is, always verify the current official guidance before making a coding decision. For your CPC exam preparation, remember, read right pointing arrow verify current rules right pointing arrow apply right pointing arrow CODE. Let's apply what we've learned to a CPC style scenario. A patient has two separate skin lesions. Lesion A is biopsied for diagnostic evaluation, while lesion B, a different lesion, is surgically removed during the same encounter. The documentation clearly identifies the lesions separately. The question is, should the biopsy automatically be bundled with the lesion removal procedure? The correct answer is B, review for separate reporting. The important point is that the procedures involve different lesions. Under applicable NCCI guidance, a biopsy of a different lesion may be separately reportable when supported by the documentation and applicable captain and NCCI rules. Now remember the CPC trap. If biopsy and removal happen on the same date, they are always bundled. That is not necessarily correct. The key question is, same lesion or different lesion? For the same lesion, think bundle. For a different lesion, check NCCI and the applicable reporting rules. Also remember, never add modifier 59 automatically just because two procedures occurred on the same date. The documentation and applicable NCCI requirements must support its use. Your CPC memory rule is, same lesion right pointing arrow think bundle. Different lesion right pointing arrow check NCCI. For the exam, always identify which lesion is associated with each procedure before deciding whether separate reporting is appropriate. Let's summarize Lesson 14, Biopsy, Excision, and Destruction. First, remember the three core concepts. Biopsy means sample. Excision means remove. Destruction means destroy. When reviewing documentation, identify the procedure performed, technique, anatomic site, lesion type, number of lesions, applicable size and margins, and the tissue removed or treated. For NCCI, remember this important distinction. Same lesion right pointing arrow think bundle. Different lesion right pointing arrow check NCCI and separate reporting rules. Avoid common CPC traps such as coding from the diagnosis alone, assuming pathology submission means biopsy, confusing excision with destruction, assuming same-day services are always bundled, automatically adding modifier 59, or relying on outdated coding information. Your code selection workflow is: read the documentation right pointing arrow identify the procedure and technique right pointing arrow confirm the site and lesion details right pointing arrow check captain guidelines right pointing arrow check NCCI and bundling right pointing arrow verify current rules right pointing arrow select the supported code. For 2026, always verify the current official guidance applicable to the date of service. Your final CPC memory is, biopsy equals sample, excision equals remove, destruction equals destroy. And remember, documentation right pointing arrow technique right pointing arrow guidelines right pointing arrow NCCI right pointing arrow verify right pointing arrow CODE. Accurate coding starts with accurate documentation.